Hello everyone, I am Paulina Bianca Pilotos, a student in the doctorate nursing program at the University of Massachusetts Global. Before becoming a nurse practitioner in a primary care clinic, I spent 6 years as a registered nurse on the medical surgical floor unit. Today, I am excited to present my evidence-based project on the effect of the Rule of Three health teaching in the daily administration of home blood pressure monitoring for patients diagnosed with borderline hypertension. This project aims to increase the effectiveness of blood pressure control in patients with borderline hypertension by using a Rule of Three health teaching model while administering the HBPM or the home blood pressure monitoring daily. The project aims to identify and address potential barriers to patient adherence to HBPM or the home blood pressure monitoring, inform patients about the appropriate use of HBPM and the significance of adhering to the Rule of Three health teaching approach, and provide healthcare professionals with the resources they need to inform patients and track their adherence to the approach effectively. The stakeholder groups involved in these projects are health professionals, patients, and healthcare system. Healthcare professionals will be critical in educating patients on using the HBPM and the Rule of Three health teaching approach. Patients will adhere to the approach and monitor their blood pressure daily. Healthcare systems will benefit from cost savings due to fewer hypertension-related complications and hospitalizations. Each stakeholder group will require different educational needs. Healthcare professionals must be trained on the proper administration of HBPM and the Rule of Three health teaching approach. Patients will need education on the importance of daily blood pressure monitoring and adherence to the Rule of Three health teaching approach. Healthcare systems will need education on the cost savings associated with improved blood pressure control and patient-centered care. The Chronic Care Model, or CCM, and the Health Belief Model, or HBM, are the project's theoretical foundation and conceptual framework. A person's propensity to act to improve their health is influenced by their beliefs about the perceived benefits of that action, the perceived obstacle to taking that action, and their perception of their susceptibility to the relevant health problem. According to the HBM, or the Health Belief Model, a well-liked health behavior model, in the context of this project, the HBM may guide the creation of educational materials for patients and healthcare professionals and assist in formulating strategies to remove obstacles to the Rule of Three health teaching approach, according to Rosenstock I et al. 2019. The CCM, or the Chronic Care Model, on the other hand, emphasizes the importance of patient-centered care, effective communication, and self-management support. It offers a structure for improved chronic illness care. The six interconnected elements of the paradigm are clinical information systems, self-management support, delivery system design, community resources and policies, and healthcare organization. The CCM may be utilized in the project's context to ensure that borderline hypertensive patients receive a high-quality, coordinated treatment that promotes self-management and adherence to the Rule of Three health education approach, according to T. Bodenheimer et al. 2019. The HBM and CCM together provides a solid theoretical foundation and conceptual framework for this endeavor, guiding the development and implementation of treatments to improve blood pressure management in borderline hypertensive patients. This approach has the potential to significantly improve the well-being outcomes for patients with hypertension by combining an emphasis on calm thoughts and behaviors with a comprehensive framework for persistent consideration of the executives. To successfully educate patients and track their adherence to the approach, the plan for providing the intervention will make use of instructional materials and patient monitoring methods. Medical personnel will closely collaborate with patients to identify and treat adherence issues such as physical restrictions or a lack of motivation. Via frequent updates and feedback sessions, stakeholders will be kept up to date on the project's development. This project's implementation would integrate into the healthcare system by addressing hypertension, a serious public health issue. Hypertension is a significant risk factor for cardiovascular disease, the leading cause of mortality worldwide by World Health Organization 2021. About 45% of adults in the United States have hypertension, according to Benjamin et al. 2018. In patients with borderline hypertension, using the HBPM and the Rule of Three health teaching approach can enhance blood pressure control and lower the risk of cardiovascular disease. In addition, implementing this initiative can lower healthcare expenses while enhancing patient outcomes. Patients may have fewer hospitalizations and problems from hypertension if their blood pressure is better managed, which might save healthcare systems money and the patients themselves. The use of HBPM and the Rule of Three health teaching strategy can also encourage patients to take an active role in their healthcare, resulting in greater self-management and improved health outcomes. As a result, individuals with borderline hypertension may have markedly better blood pressure control and a decreased risk of cardiovascular disease if the Rule of Three health teaching approach is incorporated into their daily administration of HBPM. This project has the potential to have a substantial influence on public health and healthcare expenditures through a multifaceted strategy engaging healthcare professionals, patients, and health administrators. Thank you again for your time, and please let me know if you have any questions or feedback.